So TJ, what makes VeriFide unique?
That's a great question. I love responding to this one. So I think first and foremost, we collaborated with health plans to develop a truly groundbreaking solution for the verification of a provider's credentials in a way that makes the process seamless and reduces the burden both for providers as well as for health plans of conducting this primary source verification for credentialing. But it doesn't stop there. So we are closely integrated with our flagship product, CAQH ProView, and that's really the initiation for the primary source verification process. We get the provider's credentialing profile from ProView. Now we've got about 1.5 million providers who are entering their professional information into ProView, and this allows them to enter it one time and then they don't have to send it individually to different health plans that they're contracted with. I learned recently our CAQH core team published the results of a study, and I learned that on average a provider is contracted with anywhere between 13 to 20 health plans. Now, can you imagine having to submit your profile separately to each of these 20 health plans that you're contracted with? I can think of a far better use of providers' time, like, I don't know, maybe seeing patients? And I'm sure providers would agree with this as well. So after we get the provider's profile from ProView, VeriFide will query to verify anywhere between 14 to 17 data elements. And these data elements are selected so as to be in compliance with both NCQA as well as Medicare Advantage requirements. Now, in performing these verifications, we are set up to query as many as 400 different primary sources to get the primary source verification for these different data elements. And the majority of these are conducted in an automated fashion. So it's fast, it's seamless, it happens really quickly. But we do have the ability also with our PSV analysts to be able to perform manual verifications if it's required. Now, occasionally we'll run into situations where maybe the provider's missing information in their profile or there's some discrepancies in what they're saying. And so in these cases, we're able to conduct outreach to these providers. And this is really valuable to the health plans because it eliminates for them the necessity to have to do a lot of this chase work where they are following up with the providers. And it also reduces the chances of health plan provider aberrations. So definitely a lot of value for the health plans there. Now, in terms of delivering this information to the health plan after primary source verification has been completed, look, we understand not every health plan is the same. Health plans have different requirements in terms of how they want to receive this information. Some are able to receive it in an automated fashion. Some want to go in a more manual process. And so we deliver the outcomes of PSV via two formats of a PSV checklist. So we've got a human-readable version of the PSV checklist, as well as a machine-readable version of the checklist. And the health plan can choose which one it is that they want to utilize. Both of these checklists are going to include the outcome of verification, and that's codified by a categorization, a letter categorization. And I'll tell you more about that in just a minute. But it's also got the name of the analyst that performed the verification. It's got the source, the method, the date of the verification. And where applicable, we're going to flag cases where maybe the data element that we verified is going to be expiring soon. So this is just a little heads up that the plan finds really useful. Now here's where it gets really interesting, right? So for plans that have the ability to automate the consumption of this data, it's completely seamless. So they have the ability for our machine-readable file to be able to ingest that information, and it flows directly into their provider data management system. Even better, they can write really sophisticated business rules to manage the automated routing of these files once they come in-house. So they can maybe set up rules that say, this file is clean, it can go straight to the medical director for approval. Maybe this file needs some further follow-up, maybe some clarification. Or, in some cases, this file needs to go into a termination queue because the provider needs to be terminated from network. So we've got plans that I'm always impressed. They've set up some really sophisticated business rules to route these files. I mentioned earlier about NCQA. I want to just make sure that I get this point across. We are an NCQA certified CVO. Now, this is completely voluntary, But we do this so that health plans that we are partnering with have the assurance that our processes, our policies and procedures are really in compliance with NCQA, and then it saves them the trouble from having to conduct oversight over us. So this is also something that's useful to health plans. And finally, but not least, the way we've designed the solution, we're really focused on putting the credentialing folks in the health plan firmly in the driver's seat. Now, I totally get it. You have outsourced this process to a CVO, but at the end of the day, the credentialing manager, the credentialing director, you're the one that's responsible for the final outcome of this process. And so you really want to know what's going on, how this is working out, and if there are going to be any hiccups in the process. And to help put the health plan credentialing folks in control, we created the VeriFide portal. So this is a portal that health plan users can come into. They can order initial credentialing or re-credentialing. They can search for providers based on various parameters, and they can really see what's the status of that PSV process for a given provider, really drill down into the individual order status and see if there's any deficiencies, any follow-up that's being performed, things like that. And at the end of that process, they can download the file directly from the portal itself. So the focus is really on putting the health plan user directly in the driver's seat for PSV. So there you have it. We've got all of these different things that really come together to make this a truly unique solution for credentialing.